Hi, welcome to the healthcare panel. I'm Jennifer Osei-Tutu. I served as the student coordinator.
And I'm Amy Nielsen. I'm the other student coordinator for this panel. Each panelist is going to introduce him or herself and then take about 5 minutes to kind of discuss their experience in healthcare and stuff like that. So we're going to start with Yen Lee. Mr. Lee, do you mind beginning?
Hey, how's it going, everyone? My name's Yen, and I'm a second-year medical student at Feinberg School of Medicine downtown. And I really had like a very cookie-cutter way to get into medical school. Like, the funny story is, my parents are doctors, although my dad's a researcher now. My mom's parents are doctors. My dad's parents are doctors. I was born on a medical school campus. I grew up on a medical school campus. So, unsurprisingly enough, I wound up at a medical school campus. So I got into medicine because when I was a gymnast in high school, I busted my shoulder, and I saw an orthopedic specialist. And at the time, I was just feeling so down about myself. I was letting my team down, I just felt like so depressed. And this doctor just kind of like talked to me and just helped me calm down. I always remembered how much better he made me feel in a way that I couldn't like dig myself out of. And that's why I want to go into medicine. I wanted to make other people feel that way too. So I wanted to give you like some good advice about where you are in your stage. I'm imagining all of your second years and third years, and you're probably thinking about MCATs, and you're probably thinking about extracurriculars and what it's like to apply. Well, I'll start off with extracurriculars. One really good piece of advice is find something you're passionate about. And if you're passionate about something, then when you're doing it, it doesn't feel like work. It doesn't feel like a rat race that you have to fill out. It's something you have to put on your application. And also when you talk about it, people can tell that you're really into it later on. It makes you a well-balanced person. Like I tutored my third and fourth year, and I found that working one-on-one with the 8-year-old at Ray Elementary School was such a rewarding experience. And you realize that in medicine, you get to do a lot of the same stuff. You get to form these close one-on-one relationships as well. Now for MCAT studying, I'm sure all of you are thinking about that right now, right? So here's the secret to taking the MCAT. When you're learning to ride a bike, you get on the bike and you try to ride it as best you can. It's the same idea. When you're learning to take the MCAT, you just take as many practice questions as possible. I personally took like the Kaplan course, and it was really helpful because they give you 10 tests, like 10 practice tests, and then they give you another extra practice test as well. But even if you're not taking the course, just get as many practice tests as possible. Just do them over and over again. And if you put in the time, all of you will do well. That's really all it is to it, to the MCAT. And finally, let's see, interviews. This is something that's probably like a little bit down the line, but I think it's something that really helped me out. Interviews, the secret to it is there's a website, and I want all of you to write this down somewhere. It's called, good, I like to hear the sound of all the pencils moving and all the notebooks flipping out. So it's called Student Doctor Network. I'll say it again, Student Doctor Network. On this website, people post actual interview questions that they were asked during their interviews for each specific medical school. So when you say have a interview at Rush, for example, you'll know every single thing, like pretty much what they could be asking you. I mean, granted, they'll still ask you a few things that are come out of left field, but you'll be a lot less stressed, you'll be prepared, and you'll be very concise when you're answering them. And I think that's what really helped me out, make a good impression during the interviews. And I think I'm running out of time, but I'll go over a little bit of typical med school life. So I'm a second year, and I'm a lot busier, but what my schedule is like, Northwestern is really nice since we only have a little bit of class time compared to, like, lower amounts of class time compared to most medical schools. In the morning, I'll roll out of bed, get a shower really quickly, and get to class by 8. And we have science classes from 8 to 12. And then 2 times or 3 times during the week, we have afternoon classes, which are less intense. This is when we learn our clinical skills, other special topics like medical ethics, or for instance, we're actually taking a class called Healthy Living, which is supposed to teach us med schools how to take better care of each other, because we're all second years, we're all stressed out, but that's okay. And the one thing I want you to take away from life in med school is if there's something that you want to have in your life in medical school, just plan around it and you can have it. I mean, the most important things, if you think about it, you can afford to do. Like, for instance, I'm a huge Bears fan, and it was a bad season, but I still watched every game. And I realized second year that I could watch the games by thinking that, you know what, I'll just get up maybe 2 hours early and get some work done in the morning, and maybe I'll just not goof off at night on Saturday nights so I can actually afford to do these things. And, you know, if you do these things that you find important, it makes you feel just a lot better, you know. So just remember that. And as for my future, I personally got involved with a health disparities research project while I was at University of Chicago, and I worked with diabetic patients, and I just, you know, really fell in love with the field, how with diabetic patients and chronic diseases, a patient really gets to know their doctor because they see him over and over again. Then I took endocrinology as in my senior year of undergrad, and I really liked the field, and I really want to go into primary care and eventually do a specialization in endocrinology.
My name is Julie Schriefer. I graduated in 2004. I took a year off, and then I started at CCOM, Chicago College of Osteopathic Medicine. So he asked me to come and talk to you guys about the DO option versus becoming an MD. So how many of you guys have heard about osteopathic medicine or know something about it? That's pretty good. But a lot of you don't, which is funny because Chicago is actually well known as a very DO-friendly city. And Chicago College of Osteopathic Medicine for a long time was on 53rd Street in Hyde Park. It moved to Downers Grove in the 80s. So this is something that was next to University of Chicago for a long time, and part of the history of Hyde Park for a long time. So osteopathic medicine grew out of Andrew Taylor Still in the late 1800s, who lost several kids practicing allopathic medicine, decided there was a better way. It isn't necessarily a different way of practicing medicine as it is a different philosophy of how to practice medicine and a different way of training physicians. It's based on 4 principles. The first principle is that the person to be treated is a mind, body, and spirit, and should be treated as such. The second principle is that the body has the ability to heal itself, and that should be respected. And the third principle is that the structure and the function of the body are reciprocally connected. And out of that comes the fact that we do manipulative medicine. So we're trained in, it's a 4-year program. We're boarded and licensed the same way allopathic physicians are. We have our own boards, and a lot of us take the allopathic boards. Allopathic is just what we call MDs. We are accepted into allopathic residency programs. We practice in all 50 states. We do surgery. We have full prescription privileges. We work in hospitals next to MDs, and you probably have been treated by a DO and didn't know it. However, the training, like I said, is a little bit different. We go 4 years. We spend our 2 years in the classroom the same way you do at Northwestern, and then our second year is doing rotations the same way as you would. We have extra classes our first 2 years in manipulative medicine. So what that means is we crack backs, we fix muscles, we do stretches, and we learn how to diagnose things based on the body, feeling the body. As an example, people who have appendicitis almost always have a tender spot on the tip of their rib, their 12th rib. So DOs know that. It's a quick, it doesn't mean we're not going to get a CT scan, right? But it helps us in what we do. Right now I'm in a OB-GYN internship. I just started. It's a DO internship. And I use manipulation about every day because pregnant women have an extra 9 pounds on the front of their bodies, if not more, always. So their spines are always at a place. They always have pelvic pain, and we can help that easily. And there's not a lot of things you can do for pregnant women, actually, besides give them Tylenol. So it's one way that we can help. However, I have friends who are ortho surgeons in allopathic programs. We have friends all over. I think it's a good option if you want to go into kind of general practice, because you learn how to, we do a lot more focus on history taking and treating everything. A lot of our training will do everything, you know, how would you work this patient up? And then at the end, they say, okay, stop, what's the osteopathic component? And that component might be that this person has been out of work for 2 weeks because they're in the hospital. This component might be that their children have been home without their mother for 2 weeks, and how can we get them home? It might be that they've been laying in a bed and not up. It might be that no one sent their pastor to come see them. Yeah, I'm happy with it, and I'm really excited about osteopathic medicine. I'm really excited to convince you that it is not what people go into when they can't get into MD school, because I know we have that reputation. So if you guys have questions afterwards, specifically about any of the schools or any of the components, I'd be happy to talk to you.
Hi, I'm Deborah Anderson. I'm the Public Health Informatics Officer for the City of Chicago. And being in government, we love really fancy titles like Public Health Informatics Officer, which probably doesn't mean much. But informatics is the application of information technology to either public health or medicine. And the city, we practice public medicine, which is our clinics. We do both mental health as well as physical health. And then public health is the other half of our division, which is infectious disease control and prevention. We also do policy work, we do lobbying work, health disparities, investigations. And so my job is to make sure that the folks doing that have the information technology they need or can help them do their jobs better. However, as people in public health like to remind me, they reversed the flow of the Chicago River without the use of information technology, so I am ancillary. So that is one thing that's always out there, but I'd like to think I help them do their jobs better. And so for a typical day for me, because I also do some infectious disease work, it could be helping somebody investigate a meningitis outbreak. The Department of Public Health does go out if there are 64 reportable diseases that are required to be reported to the state and your local public health department in the state of Illinois. One of them is meningitis, so we have to investigate every single meningitis, including non-bacterial, which is a waste of a lot of people's time, but it's something we have to do to make sure that it's not actually bacterial meningitis. We also fight outbreaks, so I will help people gather the information they need, and then they get a little upset, but our academic epidemiologists, they often come after the fact, and they can look at some of the information. Some of our folks will look at the one person that has meningitis, and if they're a disease investigator, they now need to find out, who do you live with? Do you go to college? Where do you sleep? Where did you go? Who did you make out with last night? Well, we got to get those people. If you didn't know his name, what did he look like? We got to track him down. Those are some really, that can make your job interesting.
Great job.
Yeah. But then our academic epidemiologists will come back later and they may say, you know what, we have a whole bunch of bacterial meningitis C. We normally only see 2 of those cases a year. We now have 3 of them. This is probably an outbreak. We also noticed this actually happened last year, primarily in the Hispanic community. We actually had an outbreak on the west side Hispanic community of meningitis, and that was the common denominator, so we could actually do target vaccinations. And so we have epidemiologists who do that, and I help them make sure that they get the information they need to make their lives easier. Also, Taste of Chicago, anyone who was here 2 years ago probably remembers that because we were in the paper for the first time in the entire history of the Taste of Chicago. There was a foodborne outbreak. That kept me up for a long time because anyone who had nausea, vomiting, and diarrhea for 2 weeks proceeded to say that they went to the Taste of Chicago and was going to sue the city of Chicago because they made them sick. But doing an investigation, we had to find out what everybody ate. When did you eat it? Because we have food inspectors at the Taste of Chicago. They inspect every booth every 2 hours. So if you don't meet the temperature requirements, we just don't like the look of your food has been sitting out too long, you will get rid of it and you will bring something else back in. So that is every 2 hours people tend to rotate their food, if not more. So that is a lot of food, and now finding out when people ate, where they ate, what they ate. Just saying you ate at this booth, okay, but did you have the turkey drumstick that everybody loves? Or did you have the potatoes? Or did you have whatever? And at the Taste of Chicago, we all know, people sample. So you probably went to 50 booths. And we now need to figure out, okay, you had the turkey, okay, what is the information? And so that's a lot of information to gather for someone to look at. So I help make it easier for people to look at that information so that we can say it was this particular booth at this particular time, and this is what people ate, this is our most likely source. We also keep samples of that food, so we have to go back, find that sample, get it tested, as well as do all the testing, collect all the tests from everybody's stool samples, vomit samples, mucus samples, and say, okay, it's actually typed back to this. So life can be interesting and pretty disgusting, but it helps people because we focus on population health, as well as the public medicine side, which is personal medicine. So public health is both. And I also, just for the folks that want to know, I have no background whatsoever in public health. I have a law degree in economics, social work, 2 social work degrees. So because it's so wide-ranging, you can come at it from a lot of angles. The vast majority of people I work with do not have MDs. MDs in public medicine tend to be, they're also somewhat ancillary unless you're in public medicine, where you're actually treating the individual patient. Otherwise, public health tends to be dominated by nurses and epidemiologists and social workers.
My name is Mary Kay Bryan. I went to the University of Chicago back, well, we used to have to like move around the dinosaurs on the way there so we didn't get stepped on, so it's a long time ago. And it says here, I'm supposed to tell you how I chose my profession, that it had to do with my house burning down and the typesetter I worked with, who was a Buddhist, telling me, you're going to love this, you know, so you don't want to hear this story. Basically, my undergraduate degree was in anthropology, and the Komaroffs, who are probably still there, but very old at this point, were interested in medicine at the time. And it just happened to be what they were doing. They were from South Africa. This was before Nelson Mandela, so they had left so that they didn't disappear. And so that's how I got interested in medicine. It wasn't that I went in there with that idea. And I came out, had no idea. An undergraduate degree in anthropology and $2.25 will get you on the CTA. So I went back to doing the work I had done before, which was I worked in my parents were journalists, just like him. My parents were journalists, my grandparents were journalists, my great-grandparents were journalists, so I went back and did artwork. So in any case, my house burned down, blah, blah. I ended up in Chinese medicine school because someone kept saying, don't you have an anthropology degree and something about medicine in, you know, other places or something? And I kept saying, I don't have any interest in China. So I went there because my house burned down, and you have to put your identity together kind of quick when that happens. And I showed up, and I thought, wow, this is it. Like the very first night, I went, oh my God, this is like it for me. This is it for me. And it was always it for me after that. So I also have a graduate degree in the history of medicine, so I know an awful lot about a whole bunch of medical systems like Ayurveda and Tivanani and Tibetan medicine, Native American medicine. I know a lot about a lot of medical systems at this point. So that's how I got to doing it. A typical day for me, I don't have a typical day. I don't like typical days, and I've set up a very carefully constructed life so that I don't have typical days. Until this semester, because I decided to go teach like every day, all day. I'm trying out the 9-to-5 thing. You know, I'm 56. I feel like now's the time. So I'm not liking it so far. I've had 2 days in a row. So I'm not caring for it. But in any case, so that means to me that I might work 7 days a week, but I might work, you know, some in the morning and then not for a few hours, and then some. So I see patients on some days. I do a lot of public health. I run, or I've helped to found a veterans clinic where we have 3 different sites that we see returning veterans. I also helped to run a clinic at the Native American Center in Chicago, which is on Wilson. And I used to do a lot of work with AIDS. And I've done lots of other kinds of public health things. I don't like fee-for-service. I really dislike the whole, you give me money, I give you health model. So I do a lot of public health and a lot of free clinics. So my days have a lot of patient. I do a lot of teaching. I'm a dean of the herb department. I work at Pacific College. I know that's kind of weird. Pacific, isn't that an ocean? Yeah, it is. It's way over there. But they have 3 campuses, oddly enough. They have one in San Diego where they started, one in Chicago, one in New York. So I'm a dean in the department there of the herb department. So that's that. Ooh, you took the questions away. He's trying to mess with me here. No. This guy's a plant. How did the university? Oh, I just got back from Cuba. If anybody's interested in the Cuban medical system, which is really awesome, and you know, I understand we have some problems with some things about Cuba and all that, but they have an awesome medical system. It's really, really impressive. And they're a little third world country that's been under a blockade for 50 years. So, like, what's our problem exactly? It's a way better medical system than ours, actually. How did the University of Chicago prepare me for this experience? I'm a working class kid from, you know, the slums, and really the USC taught me how to think straight and how to write. Those are the two main things. It taught me how to think straight and how to write, and how to become an educated person over the course of my entire life. So, so that's that. And, you know, and then there was that whole anthropology thing. What is this one? Oh, did I study abroad? Yes, I did. My degree in Chinese medicine degree, it was back in '06 when the degrees were pretty unimpressive. I studied in Chicago, but I also studied in Chengdu, which is in China, if you don't know that. That was back pre-Tiananmen Square, so it was pretty interesting, too. So let's see, what else? What do I enjoy the most or the least about my career choice? That's an interesting one. Well, I really like patient care. I didn't go into it. I wouldn't have seen myself as a clinician in that way, but it turns out I'm a pretty good one. I think that clinical skills we perhaps overemphasize the intellectual qualities. They're important. They're really important, being able to be analytical and be a problem solver. Doctors are problem solvers. I don't care what system they're in. It does not matter. They are really good problem solvers, and they're those annoying people that when you want to tell them your feelings about how you're feeling about a problem, they go, yeah, your feelings, whatever, let's fix it. Now, that's a good thing and it's a bad thing, because you really do have to care about people's feelings. So the other piece of it is having a real deep concern for other human beings and what they're going through. A lot of medicine is being able to listen to people and let them tell their story and let them tell you what's going on with them. An awful lot of a clinical experience is human contact. An awful lot of cure is about human contact. 40% of all people get better just by going to the doctor. That should tell you something right there. Doesn't matter what he or she does. So that's what I really like about it. I like teaching a lot. I'm actually very pleased to teach. It's fun. What do I not like about it? I don't like being marginalized in the way that we are. And, you know, people are going to tell you that everything's really integrated. That's not really very true. I mean, we certainly have made some inroads. People know what acupuncture is. They've heard of herbs and so on. But I feel that there are other medical systems in the world that are, you know, Chinese medicine's at least 2,000 years old. Ayurveda is probably 5,000 years old. Tivunani's like 1,500 years old, a little more than that, and so on. It's a shame to waste all that knowledge. So that's a little sad, kind of a sad struggle. It's like all dressed up and no place to go kind of thing. But that's not too big a deal. So mostly I really like what I do. So there you go. And if you want to know more about Chinese medicine school, I will say Pacific is one of the best schools there. When I started, there were 5 Chinese medical schools in the United States. Now there are 75. And Pacific is one of the best. So if you want to know more about that, I can certainly tell you. Take it away.
Okay. My name's Nir. Sorry, I just realized I should turn my phone off because my mother will call invariably. Okay. My name is Nirav Shah. I'm an attorney here in Chicago. First of all, stop writing. There's no reason to write down anything I'm going to say, so please, no reason to do that. I don't have any websites or anything. I'm an attorney here in Chicago. I graduated from Pritzker several years ago. I also graduated from the law school at the University of Chicago. I was originally an MD PhD student, and I was doing my PhD in the econ department. That was crazy, so I quit. And I went to law school, which was I think a better move. And at the end of all of it, I realized that although I enjoyed practicing clinical medicine, it wasn't really for me. Most of my real interests were in healthcare systems and public health and big systems of problems and big ideas rather than individual patients. Individual patients are great, love them, but they weren't for me. So that takes me to actually what I'd rather talk about, because my story is not that much fun or interesting. Who here is deciding whether to go to medical school? Show of hands. Right? Okay. So maybe a third of the room. Maybe even more. No, seriously. I mean, raise your hands up high. If you're just not sure if you want to go to medical school. Good. If you are 100% sure that you're going to medical school, I don't have much to say. But if you're on the cusp of deciding, well, that's who I'd like to speak to. For the people that are on the cusp of deciding, or even the people that are committed to going, do you like doing other things? Do you like hobbies? Do you like sort of enjoyment? If you do, then keep listening. So here's my shtick, and that is this: if the only thing that you can envision yourself doing with your life, I mean the only thing, is being a doctor, then you have to go to medical school. Okay? It's that easy. You owe it to yourself to go to medical school. If that's the only thing that you have ever thought that you would ever be happy doing, and then you should go to medical school. But if so far in your time at the University of Chicago, you have said to yourself, wow, I really like Russian literature. I think it'd be really great to spend some time really learning about Russian literature. Or, I think consulting is so interesting. I mean, these people go into companies or they work with governments and they help solve their budgetary problems. Or, wow, I really like public health epidemiology. I think it would be really neat to figure out how diseases spread at the Taste of Chicago. Right? Which I actually do. My real interests are in public health, by the way. I spent a couple years in Cambodia when I was in medical school, and most of my real interests are in corruption. But because that's where all the money is. If you are generally interested, or you could conceivably see yourself being interested in some of these other things, don't go to medical school. Okay? That's the strong statement. Don't go to medical school. It's too long, it's too hard, it's too emotionally and physically taxing, and it's just not worth it. The weaker statement is don't go to medical school yet. Okay? And that may be a more palatable option. Spend some time doing other things. Move to Cambodia and work as an economist or an anthropologist. Join Teach for America. Do whatever it is that you think you might be really interested in doing. One of two things will happen. You'll look back on that time and say, wow, that was time really well spent. Another way to look at that is find friends of yours that are in medical school, and in particular, find the ones that took 3 or 4 or 5 years off, and ask them if any of them regret that. Okay? If you find one person who regrets it, the steak dinner is on me. Okay? I don't think you will. Or another thing will happen while you're doing this taking time off. You'll actually find out that you don't want to go to medical school. And that's fine. That is great, in fact, because of all the things I said before about medical school. Long, hard, emotionally taxing, physically taxing. And that's great if you decide you don't want to go to medical school. You may actually find that what you really want to do is work in public health or be a social worker. Right? Maybe really what you want to do is work with people and their problems, but you don't want to spend the next 11 years of your life studying to do that. And so there are lots of other ways to do that. So if individual one-on-one contact is the way, then you may find that being a social worker is a lot better for you. If working with big systems of problems is what's interesting to you, you may find that getting a master's degree in public policy or public health or doing a PhD and working at a think tank in DC is the way to be involved with the healthcare system. But do not think that the only way to be involved in the healthcare system, whether directly or peripherally, is by going to medical school. Because in the work that I do, which is in my professional life, healthcare policy, I work primarily with the FDA on FDA policy. Doctors have zero role. It is run entirely by economists and lawyers. And on the public health side, I cross-apply with Deborah said. It is not run by doctors. It is run by epidemiologists, social workers, nurses, that group. So do not think that medical school is the only way to be involved in the healthcare system. Because really, the only thing that medical school gets you involved with is patient care. You can do other things with a medical degree, by all means. But are you really going to be running the show? No. I'm sorry. That's how it is. Now, I know what everyone is thinking. Who's going to tell my parents? All right? And the answer is, I will. And I've actually done that. And I mean, the unfortunate fact is, a lot of parents would rather have an unhappy doctor in the family than a happy social worker or a happy artist. And that's really too bad. But the fact of the matter is your parents will deal with it. Mine did, all right, when I moved to Cambodia. They dealt with it just fine, all right? And in fact, and this is a supposition, it may not actually be true, but your parents may actually in the end be more proud of you. And they'll probably, although you'll never hear about these things, they'll probably tell their friends and family about all the cool things that you're doing while their boring kids are in medical school. Okay? No joke. I mean, my parents still talk about, well, yeah, our son, he's not a doctor. I mean, he's a lawyer and he works in public health. And, on some very subtle level that they would never consciously admit, I think they're just as proud. But the real answer is I'll talk to your parents, or someone will. But if you really if you're going to medical school because you think it's the thing to do, you're setting yourself up to be an unhappy cardiologist in 15 years who goes back to business school in order to figure out how to make money.
And has a heart attack.
And has a heart attack, right? So that's my spiel. I'll turn it over.
So I'm David Weinstock. I'm going to give you a different perspective.
Great.
So the first thing I want to do actually is to congratulate you all on choosing to be here, because I think by deciding to go into healthcare, you've demonstrated that you want to be in a field where you can feel like you're making a difference, where you can feel like you're helping people, where you can help people, and where any of you within 5 or 10 years could be colleagues of us, and we would use that term colleagues, not competitors or rivals or people we're fighting for daily bread. And you know, I have a 5-year-old, and it's made a huge difference in my life and the way I think about myself. And I like to be able to go home every day and be proud to tell her what I did that day. Because I didn't go out there just to make as much money as possible, or to, you know, balance the books in some company by firing people, or by whatever other things that people do that I don't have to think about. Because what I do is I am a physician scientist at Harvard, and I focus on figuring out ways to prevent people from getting and help to treat leukemia, both in adults and children. And I find that incredibly valuable and meaningful thing to do. So actually, I'll start with my story, and then I'll get to some specific things. So I graduated from the college in '93, and wasn't really sure at that point that I wanted to go to med school. But I knew I liked science very much, and I knew that the idea of being a doctor was attractive to me. So I fit into that third of people that raised their hands. But I had applied. I did manage to get into one school off the wait list, and went to that school. And I've never regretted it. So the first life lesson I want you to take home, and it's the only thing that I'll say adamantly, is don't listen when someone tells you they are absolutely right about anything. So as much as I respect everyone on the panel, when someone tells you don't go to medical school, you shouldn't be listening to them, because that person doesn't know you, and you're a complex person with a complex life and a complex family, and you have to make your own decisions. And so the idea that we could just categorically decide this group of people should go to medical school, this group of people shouldn't go to medical school, that's nonsense. So that, hopefully I won't say anything else categorical. So I went to medical school, and I really found myself there, and really felt like I was maturing from a kid, and I still felt like a kid when I graduated from college, into an adult, and that what I was doing was important. And I started having these really meaningful interactions with patients, because even as a medical student, they look at you like someone who can help them. And you become incredibly important to them in a way that maybe you've never been important to anyone else in your life, because you're interacting with them during these most meaningful moments of their lives. All right, so we're all going to deal with illness in ourselves, in our family members, grandparents, and so on. And those experiences we carry with us for the rest of our lives. So I went on to residency, and I knew that I wanted to go into cancer by the end of medical school, because I found it, again, to be really important. And I love this interaction between science and medicine, and the idea that things are changing and improving and progressing. And I didn't want to be a dermatologist. I wanted to go home every day, like I said, and feel like I was doing something that was really important, and that in the course of my career was really going to change. Like we were going to be able to see real change and improvement in care. So I went to New York City for residency. I did 3 years of residency. So let's start adding the years. 4 years of medical school, 3 years of residency. Then during residency, I had some great opportunities. For example, I went to the Republic of Georgia in the former Soviet Union. I worked with refugees there with tuberculosis for 3 months. Like, extraordinary opportunity. But then went on to oncology clinical fellowship for 1 year, infectious disease clinical fellowship for another year. And then I decided I'd go into the laboratory. And I hadn't really taken time before then to go into the lab. And I knew that if I was going to be someone who could really change things, who could really go into the lab, discover things, move them into clinical trials and into patients, and really engender these meaningful differences, that I had to be able to do both. And so, I wasn't married at that time. I couldn't barely even get a date at that point. And right. And so I went into the lab, and I know it was a long commitment. I spent 5.5 more years in the lab, so 4 plus 3 plus 2 plus 5.5 after college. And then I got my first real job at 34. And while I was in the lab, I had other great opportunities outside of just studying. So I was a relief worker after Hurricane Katrina and worked in shelters there, as well as participating in the public health effort through my training in infectious disease. I found that really valuable. And then I moved to Harvard, and I opened my laboratory at the age of 34. And within the past 2 years, I'm now 36, we have discovered a new protein that wasn't known to be involved in leukemia. And it turns out that this protein is aberrant in about 6 or 7% of children and adults with a specific kind of leukemia. Almost everyone who has that kind of leukemia dies of it. But we've identified specific drugs that can target that, and we're opening a clinical trial nationally to target that particular aberration in this group of children with that leukemia. And we've been able to study everything from the basic molecules themselves. Literally, we synthesize these molecules and we look at them in the most in vitro system, all the way up to treating patients. And for me, that's living the dream. So the last thing I'll say is that a career like mine represents a tiny, tiny percentage of all medicine, right? And as I passed through the system, many people veered off in one direction or another. So when I finished medical school, there were people who didn't go on to residency and went on to something else. When I finished residency, there were people who did the same thing, or they went to become primary care. When I finished oncology fellowship, there were people who went on and just practiced oncology. And there were people who I knew in college who went on to be nurses or pharmacists, social workers, and so on. And I think many of them are happy, and many of them are unhappy. And it's a foolish idea that the decision you make whether or not to go to medical school is going to determine whether or not you are happy. If you went to medical school, but you shouldn't have, that you're going to be a cardiologist in 15 years with a heart attack and completely unhappy, because that's nonsense. That's true if you make a poor decision after poor decision after poor decision after poor decision. But you're going to have to make a lot of decisions in your life. And the reason why I would encourage you to go to medical school, if you're really considering it, and financially it's an option, and I'm not saying tell you to, but encourage, is that I think it opens up limitless opportunities, because you can do any of these things. And although the people with the boots on actually doing the public health investigations are mostly nurses and epidemiologists, that's true. The people running those institutions, the CDC, the public health commissioners, and so on, they are MDs. And I don't think anyone would really argue with that. And so if you want to be making the larger decisions, medical decisions in America are still made by MDs, and unfortunately, above that, bureaucrats and lawyers and so on, business people. So, but remember who the patient advocates are, right? Who's there for the patients? So at that point, I'll finish. And I think this is wonderful, actually, this back and forth. And what it really tells you, and I think Nariv would agree, is that people are different. You have to make your own decisions. So don't listen too hard to any of us. So at that point, I will stop. I think I'm last and supposed to be moderator, which really just means
I had a thought.
Go.
I just want to add one thought. I have a teacher who said a thing that I find very useful that kind of goes to everybody's comment here, which is a really useful guiding principle in life, is that your life is a path, and the goal of your life is to try to get on the right path for your life. And the way you can judge whether you're on the right path is whether or not it feels easy. If it feels hard and arduous and unpleasant, then you're not on the right path. Now, I'm not talking about whether it is objectively hard. Like, you could look at the life that was just described, and it might sound like, if that wasn't your life path, it would sound like, oh my God, did he say that he did the Katrina and something else and something else? And that would mean that wasn't your life path, because objectively that looked hard, felt hard, and so I would say that this sounds like a kind of an arduous life path because there's an awful lot to it. But for him, it felt like gliding down that path, and it all felt like it was right. So as soon as you start to feel like your life is super hard, even when it's not, like you're objectively, I'm thinking, wow, my life's not hard. Why does it feel so hard? And you're on the wrong path. And then you want to stop and ask yourself, why does my life feel so hard and so arduous and so unpleasant? And I'm not happy about this. If it feels easy to you, no matter what other people say about it, if it feels easy to you, it's probably the right path. So that's, I don't know, that helps me a lot. As soon as I start feeling like I don't like my life, I'm not happy about getting up in the morning and doing what I want to do, then I start adjusting and going, I'm doing too much of this and not enough of that, or whatever it is. And most people, I work 7 days a week, so, and I'm pretty happy about that. That's okay with me.
So why don't we open it up at this point to questions, and you can either ask to the panel or if there's one particular person. And please, someone start.
I have a question, just generally for people who've actually finished or are in med school. Suppose you did not get accepted into medical school, what would you have done, or what would you be doing?
Do you mind repeating?
So the question is, if you want to go to medical school, you apply to medical school, and you don't get into medical school, first, what would we have seen ourselves doing? And that could be either temporarily until we were able to try again, or as a career. That is a really hard question. I think I know what I would have done for a year or two. I probably would have done something like Teach for America or look for an international opportunity, because those were the things that appealed to me for the same reasons that medical school really appealed to me. I don't think I would have got a PhD because being a pure scientist alone wasn't right for me, but it might be right for some other people. But I have to tell you, I've spent half my life doing this training and becoming the person that I am. I just can't imagine being anybody else. So I find it so difficult to answer that.
I think what's interesting about medicine, there's so many different parts of it. And for me, one of the things that appealed to me most was the teaching aspect. If I hadn't gone to medical school, I can definitely see myself maybe getting a master's for teaching and then maybe starting teaching biology, because also biology was something I was really, really interested and passionate about. But on the other hand, I can also see myself, since I did a little bit of health disparities research, I can see myself possibly getting an MPH and like seeing what that would have taken me, where that would have taken me. So.
I spent the year in between graduating and starting medical school. I spent the summer working at the Brookfield Zoo, playing with children, in half the time in a lemur costume, half the time with paint like smeared across my face. Yeah, it's a good time. It was the best job I ever had, and it paid awful. But if I was in medicine, I would do that for the rest of my life.
Babysitting, second career?
Second career, yeah.
We're gonna get along just fine.
Anyone else? Questions? There's a hand back
Wait,
there.
I want to say something
Oh,
about
sorry,
that,
go ahead.
because I consider myself a doctor, whether or not the medical system does.
Like Dr. J or like no.
I think that one thing would be to like really get in touch with what it is that drives you. Why do you want to be a doctor? How do you imagine being a doctor? What does that mean to you? And then get the like core of what that means to you, and then go find something else where you could do that same thing. So if it's about clinical reality and you just really like one-on-one helping people, and that's how you perceive medicine, then there are many professions you can go into to do that, really. And but if it really isn't, it's more like, no, I'm kind of a scientist. I want to find a cure for leukemia, or I want to be part of that process. Then that's more what drives you. So I would go and look at what drives me. How do I imagine being a doctor? What is that? What is the significance? And then extract out those values, and then go find a profession that does the same values. That's what I would do. Anyway.
Okay, there's a hand. All I can see is the hand. Yes.
That's fine. I had a question just for Dr. Weinstock. I'm interested in the biomedical sciences, and I was wondering about the value of the MD actually in the lab, and if you worked with a lot of PhDs or MD PhDs, just things like that.
Sure. So I work with a lot of straight PhDs, a lot of straight MDs, and many, many MD PhDs. And I think that it's a strange decision because you can end up in exactly the same place. So what the MD offers is a perspective on the application of scientific discoveries to people that straight PhDs simply don't have, but MDs and MD PhDs do. What the PhD offers is protected time where you can really just think about science. Because in a way, doing the MD alone, you're kind of doing it on the fly. And as you saw, I did the training at the very end. And the PhD also financially is just much more feasible for a lot of people. You know, there are very good loan forgiveness programs through the NIH now. So if you do a straight MD and then you go into the laboratory, they actually forgive a significant portion of your loans. It's not as good a deal as doing an MD PhD, but an MD PhD is a really long process. So I've been talking about how long my training was and half my life and blah, blah, blah. And I'm sure that sounds really daunting and terrible, but it was great. It was great. I should have said that at the beginning. I enjoyed each step, and to get to what Mary Kay said, I never thought that I was doing the wrong thing. So, you know, we keep using this cardiologist with a heart attack analogy, but that could have been me if I pounded away at it and it just wasn't the right thing for me. The problem with the whole MD, PhD is you have to make the decision now. And in a way, that's really unfortunate. But you can get into an MD, PhD program and then back out of the PhD, for example, if it's just not the right thing for you. I think the real question is whether or not to include the MD part or not. You know, there's also, although MDs and PhDs who do 100% laboratory, and I do about 80% laboratory, 20% clinical, can end up doing exactly the same thing, 100% laboratory. Their salaries are very different. So I make twice as much money as the PhD who's in the office 2 down, and we do almost the same thing. And that's not really fair or reasonable, but that's the way the system is, and it's because there are fewer people who go through the MD track and ultimately can get to where we are and have that kind of dedication. Yeah.
My question was for just for Ms. Mary Kay Bryan. As someone who's interested in medical anthropology and saw you had a degree in that in the history of medicine, I was wondering if you knew of any other kinds of jobs working in hospitals or as a practitioner that has been, that are good for someone who's interested in anthropology, medicine, and stuff like that.
Well, let me think how to answer that. I tell people never go into any kind of alternative medicine if money is what drives you. Because I'm not saying that people here are driven by money. I'm just saying that, I'd love to make more money. It'd be great, I mean, I do fine, but so the options in terms of if you want to have a career and you're pretty concerned about material well-being and that's a big priority for you, then I would suggest becoming an osteopath or a chiropractor because they make money. I mean, they do. They make a lot more money. They're way more in the system and so on. However, if that's okay with you to not have lots of money or not be as secure about money, there are plenty of people who do what I do and make a lot of money. I'm not perhaps as much as an MD or whatever, but there are many other routes. So if what you want to do is clinical work, I mean, you could go to massage school. I wouldn't recommend it. There's a huge glut. But there are training, there's Bastyr, you can go and become a naturopath, Christian, only legal in 2 states, and so on. Naturopathic medicine is not legal in most states in this country. There are all kinds of alternative medicine things out there that you can learn. A piece of why people go into Chinese medicine a lot is it's very organized. We have a lot of schools. We have accredited schools. They're accredited through the North Central Association, the same as any university. And so people want to go into a thing that has parameters like that makes them feel like I went through a program that's somehow recognized. We've also improved our legal situation. When I first started, it was a class 4 felony to do Chinese medicine. That's like kidnapping. It carries a $50,000 fine and a 15-year sentence. So I spent 17 years under that law. And now we don't have that. So, clearly, we don't have that, and we're getting better and better. We don't have physician referral anymore, and so on. So people want to go into Chinese medicine because it's got these, you can, get credentialed, and we are getting better and better in that regard. But I don't want to be, I think it's a shame there aren't Ayurveda schools here. I know there are some Ayurveda training programs. There's also homeopathy, which is very arduous training, quite long, to become a real homeopath. And kind of looks a little like osteopathic training in terms of there being a lot of Western medicine involved in it and so on. So there are options if that's what you're talking about. There are lots of options, all the way from very marginal. I mean, there are herbalists you can go study with out in the countryside who know a ton of stuff, and when you're done, you'll know a lot, and you won't have zero legal status or credential, but you'll know a lot. You know, you could go to Cuba, where in fact natural medicine is a part of the national healthcare system. It is considered a subspecialty just like any other, and is paid for completely, as are all the physicians, by the medical system. You know, so it's a wide range of options. Kind of depends on what your goals are.
Next question.
Can any of you speak to how you would get on like a medical ethics board, or sort of what steps and the prerequisites you have to take all that?
I was actually on the ethics committee at the University of Chicago at the McLean Center for about a year, right after law school. And it's, the prerequisites are, there are none. There is no certification process to be an ethicist. And there are, the boards typically, although I only really know the one at the University of Chicago, are represented by a wide range of specialties. There was an anthropologist on when there were several people from nursing, several physicians, 2 attorneys, including myself. In terms of how to jockey for a position on one, I don't know. Yeah, so I could make something up, but really I think it's a lot of being interested and being connected with the institution and that sort of thing.
There are master's programs in medical
Yes.
ethics.
Yeah.
Yale has a very good one, for example. Actually, I participate in a presidential committee looking at medical response if there were a nuclear terrorist event, because it turns out a large number of people would have enough damage to their bone marrow that they would require oncologic bone marrow transplant type care, and that's my specialty. And so we work very closely with medical ethics practitioners, both within the government and outside the government, to try to figure out how one could apportion whatever resources are available after some kind of terrible untoward event like that. And I find it to be fascinating, absolutely fascinating, and the people to be really dedicated to concepts of sort of utilitarian versus egalitarian care, because it turns out that if you poll Americans on their opinions about response or very multiple medical ethical questions, frequently they're completely different from if you were to have the same poll among healthcare practitioners. So we tend to be much more utilitarian in our perspectives. They tend to be much more egalitarian, and how to reconcile that really requires people with dedication to medical ethics.
I think Loyola University, not to promote my other alma mater there, Loyola University's law school, I believe actually one of their I don't know if they actually have a formal track in medical ethics, but there's a big ethical component to both the law school there. But actually, one of the classes I took was on medical ethics, and they have a health law program, and you have to take their medical ethics in order to get the health law credential. So I know Loyola University here has it, and I believe they're also one of those that's also looking at getting a master's degree in the ethical sciences, or whatever it exactly would be called. And then we also have one for similar thing is I'm actually paid for off the emergency preparedness grant from the CDC. And so one of the things we have to do is, again, same thing. What happens if there's a major environmental, which includes CBRNE, which is chemical, biological, nuclear disaster? Who would get what? And again, I fully agree. Healthcare professionals are much more utilitarian, which is basically if you're in the bomb blast, bye, thanks, gone. We're not even going to pay attention to you. We have to triage. Sorry, we can't waste resources. But we actually hire medical ethicists to help us make the decisions for the city of Chicago, to keep us on a honest track, ethical track, to make sure that we're not being too utilitarian.
I think that the public health department at U of I, and they have a pretty good public health department, at least that's my understanding of it, she can speak more to that. I think it's quite well known, actually. I think they have an ethics track also. I was looking at that program years ago, so you might check out their program too if you're interested. Yeah.
Also, if you don't want to spend an extra 2 years doing a master's degree, Northwestern has a program where you can take it while you're doing medical school. And from what I've heard from some of the friends that are in it, it's not so intense. It's definitely doable. And also, you don't even need to have a degree to serve on a medical ethics board. One of my clinical instructors is on the ethics board at Northwestern Memorial, and she doesn't have a degree. She just has a lot of clinical experience, and from that you can gain, a lot of insight into that certain topic.
And since I teach ethics, I just like to say that ethics and the law are not the same thing.
What? Oh my God.
It doesn't have to do with keeping yourself from getting sued.
Yeah.
And a lot of times it's taught that way, which is I have a real burr up my nose about that.
Next question. Yes.
I have a question about MD PhD programs. When in kind of your medical school track do you decide what kind of research are you going to do, and how much do you have to reconcile it with what kind of practice you eventually want to have, what kind of medicine you want to get into?
Right. So typically, MD PhD tracks work on a schedule of 2 years. Your first 2 years of medical school, which is mostly didactic, and then you go into the laboratory for 3 and sometimes longer number of years, and then you go back and you do your clinical rotations. And so it's typically toward the end of your first year and into early second year of medical school that you're making a decision about what laboratory or what areas of science you want to study. Now, you're not committed based on that decision to pursue that area of science for the rest of your life. And you're not even committed to be a scientist. There are many MD PhDs who ultimately decide they don't want to go back into the laboratory after the 3 years, and they go on and become practitioners or ethicists or anything else that someone with an MD can do. And they have a very unique perspective, right? Because they have this additional training, and so they can see things in a way that someone who didn't do a PhD doesn't necessarily. And then it's always nice if when you go back into medical school, you choose then a specialty that gels nicely with what you've studied. But that's also not absolutely essential. So if you studied renal or kidney disease and so on in the lab, if you become a nephrologist, it makes a lot of sense. But it's not absolutely essential. And what we're learning more and more about science is that just learning to be a scientist is really the key. Knowing how to ask questions, knowing how to address them, and to solve problems, because then you can go into another field and you have the skills to be able to move on from there. So it's the same thing Mary Kay was saying and so on. You shouldn't be beating your head against the wall, and if something really captures your imagination, then that's what you should be doing. Next question.
Yeah, that's a question for Mr. Shaw. How practical, or do you believe that it is actually practical to do both an MD PhD program?
Oh. It's quite practical. I mean, it's just long. I wouldn't, I wouldn't recommend anyone to do it. To be perfectly honest, I mean, I happened into it, but there's nothing that if you really want to practice law, then just go to law school. And if you really want to practice medicine, then just go to medical school. There is nothing that the combination degree gets you. There's no door that is closed where you can only open if you have an MD and a JD. I'll put it that way. But in terms of practicality, I mean, my track was a bit more circuitous. I did 2 years of medical school, then part of my econ degree, and then I moved to Cambodia. And then I came back, and I did my 3rd year of medical school, then I did 3 years of law school, and then my 4th year of medical school. So that was a little impractical. Yeah, I wasn't the best 3rd or 4th year of medical student because I had significant gaps. So that was there may be a spike in malpractice actions for those years at the University of Chicago. But if you're really thinking about it, I mean, really you got to ask yourself really what is it that's motivating that particular degree combination? And my guess is that it's one or the other, and the combination of both may not really be necessary. I don't know. It's a statement against interest.
This is open to anyone on the panel. Can you talk about what types of experiences you had in undergrad, like some experiences that motivated your choice of career?
I went the opposite route. I had the mindset during undergrad that I was going to go to medical school and be a doctor for the rest of my life, so I was going to do anything except the 4 years before I started medical school. So I did everything except I never volunteered in a hospital. I didn't do anything like that. Instead, I volunteered and went to the zoo and things like that because I knew that I was going to be in the hospital a lot. Yeah. So that was my mindset.
Yeah, I kind of went the opposite way. Really because like working as an undergrad, working in a lab it's a pretty good deal. Like you're doing something that's interesting if you like science, and it's not so intense. You're not like clocking in every hour, clocking out like that. And so it was a good experience for me. I worked 2 summers in like research labs, and by the end of it, I kind of decided it was good because I decided that I did not really like really intense research, and that's why I got involved with more clinically geared research. Like I just emailed a few people, and I got hooked up with like the health disparities job, and I got to talk to patients in the summer. And even though I knew that I was going to go into it and I was going to be doing this all day, I didn't really mind it because that's when I like fell in love with like just being able to work with people. So it was a really good experience for me.
Undergrad, I didn't go to the U of C. I went to Syracuse University, and my year there, we were ranked 5th most party school. So probably a vastly different experience than many of you are having right now. But I was also motivated in that I only had enough money to go to school for 3 years. So I was going to make sure I graduated in 3 years. So along with partying, had to make sure I got out of there in 3 years with a degree. And actually came out with 2, so that worked out well. See, so I had a little U of C in me even before I got to the U of C. But undergrad, even with condensing it into 3 years, really is a what do you want to do? I mean, the good thing about Syracuse was you could go to basketball games, and they were pretty good basketball games. Syracuse is pretty good. You could go to football games. You could have that collegiate experience. Syracuse is also a city. It's not just a university. So you could go to the Syracuse Symphony. You could go to, I mean, it's no way near the Chicago Symphony, trust me. They did not have opera there, but you could go to Rochester to go see the opera. Is just do something. You are never going to have the experience you have now, ever again in your lives, even in grad school. Undergrad is a unique experience. This is your time to go out, and again, if you want to take that Russian literature course, go take that Russian literature course. When are you going to have time to take it again? Maybe when you're retired. Or maybe you're going to sit there and go, well, you know, I have 2 kids right now. There are classes I'd love to take. If I take a class at the U of C, it's $2,000, but you know what? My kids go to Catholic school, so I think I'm going to write out the tuition check instead. So this is a time you can take those classes and then find out, you may find out you like or don't like something based on some of the classes that you take or some of the internships you do or don't do. Is don't take it so seriously. Trust me, the vast majority of things you're thinking about now, in 5 years you won't even remember. So don't take yourself so seriously, and don't take undergraduate work or even graduate work so seriously. There's this thing called the life. This is part of it, but there's a lot more out there, so just kind of, you know, chill, dudes. You're U of C people, so you're a little prone to be a little anal retentive. But let it go sometimes, just let it go.
There's also the thing about life is that things are coming at you, and they turn out to have been really important lessons, but you don't quite get that at that moment. And part of what happened to me at U of C was that Jean Komaroff called me in, and they were grooming me to go to graduate school. And I now realize. And she said, so who do you want to study? This is what you ask an anthropologist. This is back when we were still into the interesting exotic others model. Although she would not have been one of those people who would have been opposed to that model, she still asked me, who did I want to study? And everything in me recoiled. The inherent racism and she would not be that. She's a wonderful person, but I just was like, what? Ew, gross. It just was disgusting, the idea that I would pick some group of exotic others and make it my life to study them. And so everything in me went, no, 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 I don't agree with this. And because I realized that why I had been studying the others, my area was West Africa, actually, was that I did my paper on mental health and so-called mental health in West Africa and healing cults and so on, was that I actually felt that maybe these people had something interesting to teach me. That it wasn't that I was studying them as exotic bugs, but that they actually knew something, that what they did had value and real applicability in the world. So it only strikes me later that experience really made me realize why I had been in anthropology, was that I felt that the supposedly exotic others were actually very smart people who knew all kinds of interesting stuff, that maybe we shouldn't just throw it in the garbage can because we're so cool and modern and white. And we should actually get that there are people in the world who know things, and that we ought to go talk to them and find out what they know and see if we're throwing the baby out with the bath. So I think that did have a huge effect on me, because it made me go, oh no, anthropology graduate degree, Nowadays it's very different. Anthropology is called action anthropology. You actually pick a group and try to advocate for them, particularly marginalized groups that are having a very hard time in the world. So that kind of thing she said, who do you want to go out and advocate for and represent in the UN or something? I would have gone, yeah, let's do that. So it did actually have I hadn't thought about it until you asked that question. It had a pretty profound effect on me.
Next question.
What's it like having children?
Expensive.
So I'm but
He's got young kids.
Yeah,
Yeah.
so I have a 5-year-old. My wife and I are both faculty at Harvard Medical School and both work doing similar. She's actually an informatician and an infectious disease specialist. And I might as well just tell you what our lives is like. So we have an au pair, and that's how we managed to have a child. I'm an early riser, as you probably predict, and I'm in very early. She usually goes in like 7:30 or 8. And we're always...
And that's late? Wow.
And we're both always home for dinner, always. So 6, 7 at the worst. And then we try to do as little as we can on weekends. And I think academia, which we both do, really offers that kind of flexibility. And if Sophie has a ballet recital at 2 in the afternoon on a Thursday, or her school is doing their Christmas show or something, I'm always there. Because academia offers you that kind of flexibility. If I had a private practice in a shingle and I was by myself, and my hours would be much more fixed, and so I'd be making a lot more money too. But those are some of the decisions that you have to make, and so I feel like this balance for us works out really well. So I probably work, it's probably 60 hours a week, something like that. But one of the great things I think also about research is that the meetings are frequent and in the best possible locations. So we're on 3 or 4 continents a year, and we'll bring the family or not bring the family or whatever. I'm going to Maui in a few weeks for a meeting on T-cell lymphomas. And I know it sounds just like a ridiculous thing, but actually we're going to talk about T-cell lymphomas and spend some time on the beach. And but I think finding that kind of balance is important. So that's.
So, yeah, I will fully admit, and I'm guessing there are a lot of women that will admit, you go into government because you're only legally required to work 40 hours a week and you can't get in trouble for not working X amount. I probably work 60 to 70 hours a week. I'm only legally obligated, actually, in Illinois to work 37.5. But the reason I went into government is so that, knowing that when I had kids, I would be able to find that balance, that I could go home. And I can go home. Part of what is, I'm home by 6, only because I have to pick my kids up from aftercare, and it's a Catholic school. They're very smart. They have the nun there at 6 o'clock, so if you're late, not only do you pay a fee, the guilt alone, you're just like, forgive me, sister, for I have sinned. I'm 2 minutes picking up my children. And it works, no one's late, we're all like, oh. And it's right by my house, so I'm home by 6. But after the kids go to bed, I'm definitely on the laptop, I'm doing whatever. I'm on call 24/7. I've actually received 2 calls since I've been sitting here. Thankfully, I'm actually not on call, and someone's going to be answering those. And my husband is a truck driver, and he works nights for UPS. So we've worked that out so that if one of the kids are sick, I can go in and work from, don't get shocked, 6 a.m., which means I have to get up earlier than that, but I can work from 6 to 2. Not all the time. I mean, I do have meetings, if the mayor wants to meet with you at 5, you better find a way to get your kids picked up that does not involve you. You will be at that meeting at 5 o'clock and you will smile. His kids are all grown. If he wants to stay until 7, you're staying until 7. So thank God, as much as I hate these things, there's a lot of, please pick up the kids, please pick up the kids, that I have to do with my sister. And I thank God for my sister because she can help me out sometimes. But compared to if I were working even for a not-for-profit or something else, it's a good life. I make more than a lot of people in public health because I do work for government. If you want to work in public health, government pays much better than any not-for-profit ever will, even a larger not-for-profit. And again, you have to deal with the politics and stuff of it, but the state of Chicago has no maternity leave, so I used up all my vacation time when I was out. So I'm now taking, 12 furlough days. Thank you, citizens of the city of Chicago, I'm here for you. I will not get paid for 12 days this year. All of my holidays will be unpaid. It was a great deal when you used to get paid and you didn't have to take furlough days. So there are things you have to deal with, but government, a lot of women go into government, particularly also in law. A lot of us went into government because at a law firm you have to work 80 hours and you get mommy tracked in law when you have a kid, except in government. In government, it's your first day. You don't have to carry anyone's briefcase if you went into law. The first day is, hey, here's your stack of 85 cases. You're in court tomorrow, start tomorrow. same thing in government with starting is, it's your first day, there's no wait time. They are so staff deprived, it's your first day, here you go. So you have to get used to that, but government, you're legally obligated to work X amount of time. They can't fire you for not working 80 hours, but I would say the vast majority of us do actually work more than 40 hours because we feel grateful that we have a job that allows us this flexibility. That we go home, and again, once the kids are in bed, I'm cranking out the laptop and I'm typing up all my lovely reports when everyone else is doing.
Are resources for you, and I think no one would be sitting up here on this panel if they didn't feel that way. And I've done this now 3 or 4 years, and one of the students is going to be joining my lab this summer, and I've given advice to some other students, and they seem happy with it so far. So you should feel free to email me if I can offer some kind of guidance, and I think everyone else feels the same way. And I would encourage you in general to find people outside this panel as well who are doing something that seems exciting to you. And if you contact them and it's a bad day for them, or they're just not the kind of person who does that or whatever, don't take it personally. Just move on to someone else who does the same thing, or someone else that you can find. Because there are people out there who are really great mentors just waiting for you. And how to exactly connect people can be difficult. I know the college has some very extensive systems to try to help you.
Remember, the U of C degree goes far. I did not graduate from the undergraduate degree here, yet I'm talking to you all. Aside, I'm sorry, I'm going to get a little, aside from GSB or Booth, whatever they're calling themselves now, the vast majority of somebody who graduated from Pritzker, I didn't go to med school. I actually got my social service administration degree here, not my law degree, not anything else. But there's something I can say, even though I've got a JD, you've got a JD, they're not, yours is from the U of C, mine's not, but just U of C, no matter what school,
it's a door opener.
It's a door opener.
Huge
and
door
someday, 5 years from now, after you guys have graduated and gone on and doing something, we may call you up. So U of C also opens up a lot of doors, even for the graduates that went here, if they went to grad school or something like that. So the U of C is something you should really take advantage of, because people who even live in Hyde Park, who have this, I live in Hyde Park, therefore I'm part of the U of C community, will still do something for a U of C grad. So always, keep that in mind, that the U of C is this big family community. So I may not be able to help you, but I may know somebody who went to Pritzker. I may know somebody who actually went to the Booth School. I may know somebody who got their humanities degree. And U of C will open a lot of doors. And I've noticed that from my other colleges, that's not necessarily there. The U of C, it is there. So remember that, and remember what alumni do for you. So when you become an alumnus,